1. A wound care assistant instructor designs a training session based on Knoll's principles of adult learning. Which of the following strategies best aligns with this theory? A. Relying on lectures and note-taking. B. Incorporating learners' past experiences into case discussions. C. Giving quizzes at the start of each session. D. Using child-based instructional materials. 2. While observing a trainee in a wound dressing procedure, the instructor notes repeated breaches in a septic technique. What is the most effective immediate instructional response? A. Allow the trainee to finish and review later. B. Publicly correct the trainee to set an example. C. Pause the procedure and provide corrective feedback privately. D. Report the error to the state board. 3. In designing an evaluation tool for assessing wound cleansing skills, which of the following is the most appropriate? A. Likert Scale Survey. B. Checklist with observable behaviors. C. Written multiple choice test. D. Peer review form. 4. During a clinical rotation, a trainee expresses discomfort when caring for a patient with necrotic ulcers. How should the instructor respond? A. Reassign the trainee to another patient. B. Counsel the trainee about professional obligations and provide support. C. Ignore the concern and proceed with rotation. D. Disclose the trainee's concern to the patient. 5. Which of the following best reflects an ethical responsibility of the wound care assistant instructor? A. Altering performance records to help students pass. B. Sharing patient data to enhance learning. C. Maintaining confidentiality in student evaluations. D. Promoting students regardless of readiness. 6. What is the primary purpose of using rubrics in student performance evaluation? A. To add subjective interpretation to grading. B. To standardize and clarify grading criteria. C. To expedite the testing process. D. To replace clinical assessments. 7. A wound care assistant curriculum should be primarily based on A. Student preferences. B. State regulatory requirements and patient needs. C. Hospital marketing goals. D. Instructor's teaching style. 8. Which of the following communication techniques is most effective when mentoring a struggling trainee? A. Use of directive feedback in front of peers. B. Avoidance of negative comments. C. Constructive feedback with specific performance examples. D. Repetition of the same instructions. 9. What best demonstrates the concept of formative assessment? A. A final practical exam. B. Mid-course feedback on dressing changes. C. An end-of-course written test. D. A clinical pass-fail decision. 10. In a train-the-trainer program, one key objective is A. To replace clinical experience with theory. B. To improve test writing skills only. C. To enhance instructional and mentoring abilities. D. To focus only on documentation practices. 11. The legal responsibility of the wound care assistant instructor regarding documentation includes A. Keeping only successful evaluations. B. Maintaining all records in accordance with state and institutional policy. C. Disposing of records monthly. D. Handwriting all evaluations. 12. A key method of supporting adult learners in a wound care course is A. Repeating lectures verbatim. B. Encouraging self-directed learning projects. C. Mandating rote memorization. D. Ignoring prior experiences. 13. During a debrief, an instructor asks open-ended questions about a recent patient care situation. This primarily promotes A. Memorization of steps. B. Passive learning. C. Reflective learning and critical thinking. D. Lecture reinforcement. 14. A clinical instructor overhears a trainee discussing a patient's condition in a public hallway. The best course of action is to A. Report the trainee to HR. B. Ignore it and continue rounds. C. Intervene immediately and provide a private HIPAA refresher. D. Ask another instructor to handle it. 15. The most effective method for teaching wound packing in adult learners is A. Diagram explanation. B. Instructor demonstration followed by supervised practice. C. Providing a textbook chapter. D. Assigning independent study. 16. What is a major risk of failing to document clinical competency accurately? A. Reduced student morale. B. Personal instructor liability. C. Less student-teacher interaction. D. Poorly written curriculum. 17. A train-the-trainer course should ensure instructors understand A. Advanced surgical wound care. B. Theoretical frameworks only. C. Adult learning, evaluation, and compliance frameworks. D. Corporate communication. 18. An instructor reviews a student's dressing change and says, "You missed 3 critical steps and your technique was careless." This feedback is A. Specific and supportive. B. Constructive and timely. C. Nonspecific and discouraging. D. Effective due to its urgency. 19. What is the role of the wound care assistant instructor in curriculum development? A. Following textbook order without deviation. B. Developing objectives based on learner needs and practice standards. C. Relying solely on hospital policy. D. Delegating all planning to senior management. 20. The use of simulation in wound care education best supports A. Only theoretical learning. B. Skill rehearsal in a safe environment. C. Memorization of procedures. D. Eliminating clinical placements. 21. In mentoring a new assistant, which strategy is most effective? A. Allow them to observe only. B. Assign them the most complex tasks first. C. Set goals and provide regular check-ins. D. Avoid giving critical feedback. 22. One principle of adult learning theory is that adults are A. Dependent on teacher instruction. B. Uninterested in self-assessment. C. Motivated by practical application. D. Focused only on passing exams. 23. Which approach best supports culturally competent instruction in wound care? A. Ignoring cultural differences to promote equality. B. Incorporating patient cultural preferences in care simulations. C. Avoiding discussion of cultural norms. D. Prioritizing Western medical models only. 24. A student fails to meet performance criteria on a wound care practicum. The best instructor action is to A. Give a passing grade to maintain morale. B. Discuss a remediation plan with clear objectives. C. Ignore and move forward with the group. D. Remove the student from the program. 25. Which of the following best characterizes summative assessment? A. Ongoing quizzes during sessions. B. End-of-program skill validation. C. Informal check-ins during rotations. D. Unscheduled observation. 26. To ensure regulatory compliance, all wound care training documentation must be A. Encrypted and password protected. B. Maintained in accordance with accrediting and state agency guidelines. C. Written in legal terminology. D. Discarded post-graduation. 27. A lesson plan on wound care should include A. Only a list of required readings. B. Objectives, methods, materials, and evaluation criteria. C. Guest speaker names only. D. Copies of regulations. 28. An instructor uses a learning contract with a student. This is most aligned with A. Instructor-centered education. B. Passive student participation. C. Adult learning and accountability. D. Standardized testing. 29. What is the most appropriate action after a trainee shows consistent errors in hand hygiene? A. Allow them to continue and reassess later. B. Retest only with written exam. C. Provide immediate retraining and reassessment. D. Give a warning without intervention. 30. The most ethical response to discovering an error in student documentation is to A. Correct it secretly. B. Notify the student and review proper protocols. C. Ignore if minor. D. Erase the incorrect entry. 31. A scaffolding instructional approach means A. Removing all assistance immediately. B. Gradually increasing task difficulty with support. C. Encouraging students to guess steps. D. Avoiding step-by-step instruction. 32. When preparing students for state certification, instructors should A. Teach only what will appear on the test. B. Provide comprehensive practice in both skills and knowledge. C. Emphasize memorization of rules. D. Encourage test anxiety to promote effort. 33. The best technique for documenting student progress is A. Periodic summaries without dates. B. Detailed, dated entries using objective language. C. Verbal feedback only. D. Student journaling. 34. To ensure fair grading, clinical performance should be assessed using A. Personal impression. B. Institutional goals. C. Validated performance checklists. D. Student feedback. 35. The instructor's communication during debriefs should be A. One-directional. B. Critical and assertive. C. Dialogic, reflective, and focused. D. Avoidant of negative topics. 36. One main goal of curriculum mapping is to A. Eliminate redundancy and ensure alignment. B. Replace teaching goals. C. Add personal interests. D. Expand lesson duration. 37. Which activity best supports hands-on learners? A. Group discussion. B. Clinical simulation. C. Reading assignments. D. PowerPoint lectures. 38. A student challenges an evaluation. What is the instructor's first action? A. Deny and close discussion. B. Invite the student to review the rubric and documented feedback. C. Increase grading strictness. D. Refer to legal counsel. 39. An instructor integrating multiple learning styles will A. Use lectures only. B. Combine visuals, demonstrations, and hands-on tasks. C. Focus on exams. D. Avoid alternative materials. 40. What is the best way to maintain confidentiality in student documentation? A. Use initials and secure storage. B. Email student grades openly. C. Allow shared access. D. Avoid documentation entirely. 41. When evaluating the effectiveness of a newly implemented wound care training module, which method offers the most comprehensive insight? A. Student attendance rates. B. Instructor satisfaction. C. Pre- and post-assessment comparisons with skills demonstrations. D. Informal student comments. 42. In accordance with FERPA and HIPAA, which of the following actions is a violation? A. Reviewing student clinical evaluations in a closed office. B. Storing signed evaluations in a locked cabinet. C. Discussing a trainee's performance with their coworker without consent. D. Emailing feedback to a student's school email. 43. When creating learning outcomes for a wound debridement lab, the instructor should ensure they are A. Broad and philosophical. B. Based on student preferences. C. Measurable, specific, and competency-based. D. Focused on time constraints. 44. Which communication technique best supports clarity and trust in clinical feedback? A. General praise. B. Vague suggestions for improvement. C. Specific, timely, and balanced comments. D. Technical language and acronyms. 45. A wound care assistant instructor observes that students are disengaged during lectures. What is the most effective strategy to increase engagement? A. Extend lecture duration. B. Require note submission. C. Integrate case-based discussions and interactive elements. D. Reduce class frequency. 46. What is the instructor's primary responsibility during clinical skill evaluations? A. Offering peer comparisons. B. Providing continuous verbal encouragement. C. Ensuring objectivity and alignment with assessment criteria. D. Coaching through every step. 47. A trainee refuses to participate in a wound care simulation citing religious objections. How should the instructor respond? A. Require participation or assign a failing grade. B. Refer the trainee to HR. C. Explore alternative learning methods that respect their beliefs. D. Remove the student from the program. 48. Which of the following best characterizes the role of feedback in clinical instruction? A. Delayed and generalized. B. Sporadic and unstructured. C. Immediate, clear, and supportive of growth. D. Based on peer consensus. 49. An instructor notices a student performing all tasks competently but lacks confidence. Which mentoring strategy is best? A. Assign independent practice without guidance. B. Offer public recognition without feedback. C. Provide constructive praise and gradual responsibility increase. D. Let the student observe until ready. 50. How should instructors address diverse literacy levels in course delivery? A. Avoid written material entirely. B. Provide information in multiple formats and reading levels. C. Focus only on verbal instruction. D. Use complex terminology consistently. 51. What should be done when a student asks for clarification during a wound irrigation demonstration? A. Ignore the question and continue. B. Re-explain using multiple methods, e.g., demonstration, visual aids. C. Refer them to the textbook. D. Ask another student to explain. 52. The principle of readiness to learn in adult education means: A. Adults can learn only after passing a written test. B. Instruction should be delivered regardless of student engagement. C. Learners absorb best when material is relevant to their current needs. D. Adults are naturally motivated to learn all content. 53. What is the most important aspect of a clinical practicum orientation? A. Staff introductions. B. Review of daily schedule. C. Clarifying objectives, expectations, and evaluation criteria. D. Facility tour. 54. Which approach best supports students in developing clinical reasoning? A. Repetition of rote tasks. B. Encouraging questioning and decision-making. C. Memorization of policy. D. Restricting communication with staff. 55. What is an appropriate instructor response to a student who falsifies a clinical record? A. Immediate termination without discussion. B. Private meeting followed by written documentation and program policy review. C. Publicly reprimand the student. D. Allow a one-time exception. 56. The goal of using case studies in instruction is to: A. Entertain students. B. Promote passive reflection. C. Develop problem-solving and critical thinking skills. D. Replace clinical experiences. 57. What is the most effective format for clinical evaluation documentation? A. Oral feedback only. B. General notes in paragraph form. C. Structured forms with objective criteria and instructor notes. D. Student narrative reflections. 58. Which of the following is a legal responsibility of instructors in training documentation? A. Allow students to self-evaluate. B. Maintain documentation for the minimum period required by regulations. C. Keep only digital copies. D. Use unapproved templates. 59. What is the benefit of a flipped classroom model in wound care education? A. Eliminates need for classroom instruction. B. Places theory at the end of training. C. Encourages pre-class learning and in-class practice. D. Removes clinical assignments. 60. To ensure objective performance assessment, instructors must A. Consider student personalities. B. Use standardized checklists and scoring rubrics. C. Grade based on effort. D. Allow peers to evaluate each other. 61. Which of the following would most effectively enhance student clinical confidence? A. Extended lecture sessions. B. Individualized mentoring and practice opportunities. C. Emphasizing policy memorization. D. Reducing skills lab time. 62. During a training audit, a regulator asks to review student evaluations. What is the instructor's responsibility? A. Deny the request. B. Provide all documentation in accordance with FERPA guidelines. C. Refer them to IT. D. Hand over only summary data. 63. A student consistently completes tasks without communicating with the team. What is the best instructor response? A. Assign individual projects. B. Discuss the importance of collaboration and coach interpersonal skills. C. Ignore unless errors occur. D. Evaluate only technical skill. 64. Instructors can foster intrinsic motivation in adult learners by A. Offering monetary rewards. B. Connecting learning to personal and professional goals. C. Limiting curriculum to required content. D. Assigning mandatory group work. 65. What is the primary goal of clinical site agreements in training programs? A. Limit instructor responsibilities. B. Establish expectations and legal responsibilities for student placements. C. Reduce liability for students. D. Avoid supervisor involvement. 66. When should an instructor complete a student's clinical evaluation form? A. At the end of the program only. B. During each observed competency. C. Based on peer report. D. After a classroom lecture. 67. An example of a SMART objective for a wound dressing module is A. Students will know about wounds. B. Students will understand sterile fields. C. Students will demonstrate sterile dressing change using correct technique within 10 minutes. D. Students will read about dressing materials. 68. When mentoring a student with test anxiety, the most effective strategy is A. Ignore the anxiety to build resilience. B. Refer directly to a counselor. C. Offer support, study strategies, and stress reduction techniques. D. Replace exams with extra credit. 69. A well-developed wound care curriculum must A. Stay unchanged over time. B. Be guided by regulatory standards and current practice evidence. C. Eliminate hands-on training. D. Be created by students. 70. Which behavior indicates reflective learning in a clinical setting? A. Repeating tasks exactly as shown. B. Asking questions about why procedures are performed. C. Avoiding discussion of errors. D. Memorizing textbook content. 71. To align instruction with diverse learning styles, instructors should A. Use a single standardized format. B. Adapt methods to include visual, auditory, and kinesthetic elements. C. Focus on reading assignments only. D. Grade students on speed alone. 72. What is the best course of action when a student refuses feedback? A. Record the incident and discontinue training. B. Inform the class and use it as a lesson. C. Explore the reason for resistance and address it professionally. D. Avoid giving further feedback. 73. Instructors should interpret and apply OSHA guidelines in training by A. Referring students to online resources. B. Including them in all wound care procedures and PPE modules. C. Ignoring them in non-clinical settings. D. Assuming students already know them. 74. What is the most effective way to ensure students retain wound care skills? A. Give a final test only. B. Conduct repeated hands-on practice with feedback. C. Rely solely on simulation. D. Assign reading material. 75. A student is struggling with time management during clinical tasks. The instructor should A. Allow failure to build experience. B. Ignore unless safety is affected. C. Teach time prioritization techniques and supervise performance. D. Remove complex tasks. 76. How can instructors ensure fairness in student grading? A. Grade subjectively. B. Use anonymous peer reviews. C. Follow consistent criteria and avoid bias. D. Grade according to effort alone. 77. What is the role of a preceptor in clinical education? A. Replace the instructor. B. Supervise without involvement. C. Model professional behavior and guide skill development. D. Monitor only documentation. 78. Which method helps measure the long-term impact of wound care training? A. End-of-class quiz. B. Instructor feedback form. C. Post-program follow-up on clinical performance and job retention. D. Daily attendance. 79. During remediation planning, which approach is most constructive? A. Criticize the student's performance in group settings. B. Develop a structured plan with student input and defined goals. C. Repeat original lessons without change. D. Refer immediately for dismissal. 80. A student performs well academically but struggles clinically. The instructor should A. Pass the student based on test scores. B. Reassign them to another instructor. C. Provide targeted coaching and additional clinical practice. D. Ignore the disparity. 81. Which principles should guide curriculum evaluation? A. Student complaints. B. Accreditation demands only. C. Learning outcomes, relevance, and student success. D. Instructor preference. 82. If a trainee reports feeling unsafe during a wound care rotation, the instructor must A. Dismiss the complaint if unwitnessed. B. Immediately assess the environment and take appropriate action. C. Ignore it to promote resilience. D. Advise the trainee to avoid that patient. 83. Which is an example of competency-based instruction? A. Completing textbook chapters. B. Passing a theory exam. C. Demonstrating wound dressing skills accurately in clinical conditions. D. Participating in classroom debate. 84. To ensure student engagement during virtual instruction, instructors should A. Avoid video interaction. B. Use interactive polls, breakout rooms, and visual aids. C. Provide PDFs only. D. Rely on student initiative. 85. A key requirement for instructor qualification in train-the-trainer programs is A. Administrative experience. B. Peer-reviewed publications. C. Verified clinical expertise and teaching proficiency. D. Research background. 86. If a student uses improper terminology during wound documentation, the instructor should A. Mark them as failed. B. Encourage slang use for efficiency. C. Review and reinforce appropriate medical language. D. Ignore it unless repeated. 87. Which of the following promotes active learning in the classroom? A. Passive lectures. B. Student note copying. C. Role plays and real-time case analysis. D. Repetitive worksheet drills. 88. An effective mentorship outcome is demonstrated when A. The student relies entirely on the mentor. B. The student completes work alone. C. The student gains independence and reflective capacity. D. The mentor completes tasks for the student. 89. How can instructors stay current with regulatory changes in CNA wound care training? A. Wait for employer updates. B. Follow state board newsletters and attend continuing education. C. Ask former students. D. Avoid change to maintain stability. 90. Which strategy best helps students transfer knowledge to practice? A. Memorizing charts. B. Lectures without application. C. Case-based simulation and clinical reflection. D. Reading instructor notes. 91. A student expresses confusion about the rationale for negative pressure wound therapy. The instructor should A. Redirect the question. B. Provide explanation using clinical evidence and diagrams. C. Say it's not important to understand. D. Test them on it later. 92. Which is the most important aspect of maintaining professional boundaries as an instructor? A. Socializing with students. B. Keeping evaluations subjective. C. Avoiding favoritism and dual relationships. D. Sharing personal contact information. Wound care assistant. The Wound Care Assistant test is a specialized certification exam designed to assess the knowledge and skills of individuals supporting wound management in healthcare settings. This exam evaluates a candidate's proficiency in wound assessment, basic dressing procedures, infection control, documentation, and communication with clinical teams. It also emphasizes patient care, comfort, and education related to wound healing and prevention. The test is typically required for certified nursing assistant CNAs or similar healthcare personnel seeking advanced roles in wound care support. Candidates are assessed on both theoretical knowledge and practical competencies to ensure safe, compliant, and effective wound care practices under the supervision of licensed clinicians. Here are the top 5 beneficial uses of the sample exam. 1. Enhances clinical competence. The test validates essential wound care knowledge, ensuring assistants are prepared to support complex wound management with confidence and skill. 2. Improves patient outcomes. Certified assistants contribute to more effective wound healing, reduced infection rates, and improved patient comfort through accurate care techniques. 3. Supports career advancement. Earning wound care certification allows CNAs and other healthcare workers to expand their scope of practice, qualify for specialized roles, and increase job opportunities and earning potential. 4. Promotes regulatory compliance. Certified wound care assistants help healthcare facilities meet training and documentation standards, supporting legal and accreditation requirements. 5. Strengthens interdisciplinary teams. The test ensures assistants are prepared to collaborate effectively with nurses, physicians, and therapists in wound care planning and delivery.